Welcome to This Week in Health IT events, where we amplify great ideas with interviews from the floor. My name is Bill Russell, healthcare CIO coach and creator of This Week in Health IT, a set of podcasts and videos dedicated to developing the next generation of health leaders. We want to thank our founding channel sponsors who make this content possible, Health Lyrics and VMware. If you want to be a part of our mission to develop health leaders, go to thisweekhealth.com/sponsor for more information. This episode is sponsored by Health Lyrics. When I became a CIO, I was really overwhelmed at first, and one of the first things I did was to sign a CIO coach to walk with me through the journey. This was someone who had wisdom that can only be gained through years of experience. It was invaluable to my success in the role, and I now coach CIOs through Health Lyrics. If you want to learn more, visit healthlyrics.com or drop me a note at bill@thisweekinhealthit.com. Over the next 3 weeks, we have a huge treat for you. I'm really excited about it. I just got back from the CHIME Fall Forum in Scottsdale, which was a great event, and we caught up with 12 active CIOs from various size health systems and asked them to take a look back at 2019 and a look forward at 2020. You're going to hear what they're excited to have accomplished last year and what they're looking forward to accomplish next year. I asked each of them the same 8 questions, and I think you're going to be fascinated to hear the similarities and the differences based on where they're at, geography, and other things. Each of these interviews is about 10 minutes long, so you can listen to them really quick, and some of you listen at 1.5 times speed, so it's going to go like that. We're going to publish one a day with a few Newsday episodes sprinkled in through the end of November, so check back every day for the next episode, and don't forget to look back to see if you missed any. Our next guest is Dr. Shafiq Rab, the CIO for Rush in Chicago, and he really needs no more introduction than that, so here it is. So I'm going to ask you these questions. You don't need to see them, do you? No, I mean, you're...
Come on, man. When was the last time I read a question?
I know. So let me ask you this question. How's the role of the CIO changed in this year? Not over the last 5 years, because we know that it's become more business-centric and less about technology. But how's it really changed over the last year, do you think?
The role of the CIO?
Yeah.
I think in this year, 3-4 things have become very important. And for a CIO, you need to know how the government is changing, the rules, regulation, transparency of data, API, apps. CMS was not that forward before. So Seema Verma did a great job, man. I mean, they opened up the APIs for the CMS data. So what that did was that interoperability, data, blue button, all those things started playing a different role, and then started fearing if the data gets out, what's going to happen. Cybersecurity has always been there, but the amount of attacks and other things, that also created a new idea of business continuity. New means because every time I talk to a CIO, they'll say, oh, we got 3 data centers. But if they all get hit by wormware, what are you going to do, man?
Right.
Ransomware, you can bring your tape back or you can bring your digital thing back, but you need a hardware. So cloud computing and putting things in the cloud became important. Well, only in the last 6 months, big EHRs like Cerner and Epic said that they're ready to move to the cloud. So that was a big thing that was not before.
Yeah.
I think the last thing that I think that's happening is that institutions are saying that the CIO needs to become part of revenue generation. Like, it was not the thing. Technology was not mature, 5G was not there, the edge computing was not there, cloud computing was not there, government rules were not there. And then bigger companies, Amazon, Google, and Apple, they started saying they are interested in healthcare. Yeah. So all these things together has made the CIO a little worried. If they are not, then they may be strategizing about it.
Yeah. So what are maybe a couple priorities that your health system's looking at next year that IT is going to support?
So in our health system, we are a little, I don't know, different maybe. So it boils down to 4 things. 1, how to make the patient happy. So patient experience, patient happy. Second, how to make the caregivers happy. Simple. It's not like so. And then I'll go to the intricate detail of it. And the third is that people who come to work at our places, they should be happy.
Yeah.
So these are the three guiding principles. And in that, lastly, we need to make some money. And I also have a university responsibility. So how to make the students happy. So what that means that any strategic decision we make, whether it's virtual care, telemedicine, it all centers around the how to make the patient happy.
Yeah.
Similarly, within the physicians, if you're trying to reduce the burden, or you give them something to speak on, or so typing goes away, or make the template better, or buy newer tools, that goes there. For staff, is how to bring efficiency in work, using lean tools, business processes, making them better. So IT has to actually become efficient.
Yeah. So let's talk about those two things. Let's talk about the patient. What's one thing that you guys are doing in the patient area that the patients of Chicago should know about, that they'd be excited to know that you're doing?
So 2-3 things I can tell you. You're asking about one thing. So patients in Chicago can download our app. It's a MyRush mobile app. What that does, you can have a on-demand call, video, visit. You can do an e-visit. You can get all your records. You can get all your pharmacy records. You can get all your things, but also you can do appointments. But that's not the only thing. You can look up symptoms. You can tell that you're coming at what time to the ED if you're on your way. So things like that. And if you're a Medicare patient, you can download your entire 5 years worth of Medicare information on your phone and then share it with any doctor you want. You can get a prescription. You can get an appointment with anybody. You can cancel an appointment if the new appointment opens up. So all service oriented. You can put a payment plan to make your payments, things like that.
That's pretty exciting. What's one area that you're looking to make the clinician's life or experience better?
So recently you might have heard the ACI announcement between Microsoft and Nuance. So we were one of the sites where we are developing ambient clinical intelligence. Patient doctor sits in a room and the information directly goes in the EHR. Nobody has to ever type.
Right.
So what we are trying to do is to take away the burden of typing. Second, what we are trying to do is to bring things in 6 clicks or 8 clicks, so that the entire visit from the beginning till the end is done in 8 clicks. That means pre-bringing the orders, pre-bringing the prescriptions. So it saves some time. And also if they forget something during documentation that people get paid for, it automatically pops up so they can look at it and sign it. So those kind of things working with the doctors.
The whole visit, from the time they show up till the time they leave, what'd you say, 6 clicks, 8 clicks?
So idea is 6 clicks, but presently we are at 11 clicks. We want to bring it to 8 clicks.
That's fantastic.
Yeah, we'll announce that. I mean, because it's very simple. Think about it. What do doctors do? When they have a patient, they open up a thing and they read it. Half an hour outside before going in, right? So if that is composed in a longitudinal study, they can read in 1 second, right? Similarly, when they take the notes, like talking to a patient, information goes directly in. But after assuming that, the doctor says, well, this person has this disease. The moment he thinks what he has, what's the next thing the doctor does? He thinks about the lab information. We bring all the labs pre-filled, check it, click it. Then what does he do? Write a medication, pre-filled, check it, move on. Then what he does? He refers, gets a consultant. Prefix, click it, gone. So it should be that intuitive.
Should be. I'm looking forward to following up with you on that.
Come on over a couple of months. That's it.
Greatest IT success for 2019 for your team?
My greatest success was that we work in Garfield Park with our community. There's a school there. So in the last 3 years, we took 80 students as interns at our place, high school kids. We got 56 of them certified in Epic. So they are now making $80,000 a year. That's the unbelievable success. But they work 20 hours for us and they go to college, Malcolm X College. So if they maintain B average, the tuition is free. For the masters, they can come to Rush and get BSN, MSN for free. So if you're asking what is the biggest success for my IT department, we teach at that school and we're serving our community.
That's awesome as well. Missed opportunity for 2019, something you're going to look back on 2019 and say, man, I wish we would have done that.
Business process automation. I wish I had done the robots and I had done the chatbots and should have gone after the mundane work, even in ERP and those areas, AP, payroll, I missed that. I should have done the bots there.
I don't think you're too far behind anyone else, but yeah, we're talking to a lot of people right now about RPA. It seems to be front and center.
Yeah, we're talking about it, but I mean, come on, man, I should have done it. Yeah. I just didn't do it. So, I mean, you're asking a direct question.
Talk to Daniel. Daniel's doing a lot of it.
So. Well, Daniel is a good friend. I mean, I love him, man. He's a brother.
Yeah, he on one of the podcasts, he shared some of the stories they're able to do.
For the phone calls?
Yeah.
Yeah, I know that one.
Very exciting.
Well, the thing that killed us is this stupid cybersecurity. Because, when you click on an email, so we now put a virtual browsing. So you click on it, it's not going to go anywhere. Till it's a known domain, known place, then goes. So even there's protection, we have to spend time in educating people. Cybersecurity is for real, man. Oh, yeah? I'm telling you, there is no digital security initiative without cybersecurity.
Absolutely. Area, this might be a leading question, but area where you would like to see more innovation?
The area where I would like to see more innovation in me is the understanding that our future depends on 5G, sensors, and continuous monitoring. But even if you monitor, there's no central place where somebody is looking at it. Like, when the planes come to an airport, you have a tower, right? So we are all doing it individually. For our hospitals, we may have a hospital monitoring system, but we don't have a community or like a lifetime of a person somewhere where the data is being collected and some information is being understood and the continuous feedback going. We're doing continuous blood glucose monitoring, but we're not giving the continuous feedback. You know what I'm saying? So the innovation is that the participation of the patient and the participation of the community has to come to one place.
Is 5G going to change what goes on in the hospital, or is 5G going to enable us to do more things out in the community and in the home?
So City of Chicago is now lit up with a Sprint, AT&T, and Verizon. I have all three phones. So in my mind, because I did that study, you can download a 30 slice of MRI sitting outside McDonald's in downtown and hooking up to Rush in less than a second. 2.3 gigabyte per second I clock. So what I'm saying to people as the 5G goes forward, the speed at which, so it's not based on a hospital. You can put antennas in the hospital, but the real benefit is outside. From home, you can do real video with one doctor and bringing 5 other doctors into the same concept or contact. Like you can go up to 10 gigabit per second, but it's not there yet. And as the antennas go forward, the idea is that when you sit in a car, imagine your steering wheel is made up of bacteria-resistant material, so you don't get infection. You sit, it takes your weight. Sensors look at you. If you're sleepy, it bigs an alert, wakes you up, right? That information goes somewhere that's real time. The sensors also look at your respiratory rate, your breathing rate. So today you have OnStar after the accident. This is OnStar before the accident.
Fantastic. Health IT roles you think you're going to hire more of in 2020?
For me, the new roles or the old roles, but I can tell you, CDA was very important, Chief Data Analytic Officer. Chief Business Officer is also important now because we don't go to MBA schools yet. Most of us should go to good places. CISO is important. Chief Health Information Officer is important. Chief CTO is important. But in my mind, 2-3 things have to happen. We still don't have a Chief IT Experience Officer. Like we have a Patient Experience Officer, but we have never paid attention to the experience that we deliver to our customers. So that's something new that I'm thinking about. And the last thing that I'm thinking about is that we all have a cloud strategy, but we don't have a chief cloud officer, because cloud is where you do the experiment, and phone is the edge computing where you do the actual interpretation of it.
Yep, absolutely. Shafiq, thanks for your time. We'll have to do a full episode a little later.
Absolutely,
just
brother.
do a quick one here.
Thank you.
I appreciate it.
Thank you.
I hope you enjoyed the conversation. Remember to check back often, as we are going to drop an episode a day for most of November of 2019. Following that, please come back every Friday for more great interviews with influencers. And don't forget, every Tuesday we take a look at the news which impacts health IT. If you want to support the fastest growing podcast in the health IT space, here's a few ways that you can do that. The first, share it with a peer, share it with a friend, share it with somebody who's working right there next to you. Number two, sign up for Insights and Staff Meeting. These are services designed to help you in your career. Number three, interact with our social media content on Twitter and LinkedIn. Number four, post or repost our content. And number five, always send me feedback, bill@thisweekinhealthit.com. Your insights continue to shape the channel. This show is a production of This Week in Health IT. For more great content, you can check out our website at thisweekhealth.com or our YouTube channel. Special thanks to our sponsors, VMware and Health Lyrics, for choosing to invest in developing the next generation of health leaders. Thanks for listening. That's all for now.